In today's video, we're going to be talking about taking the Psychiatric Mental Health Nurse Practitioner exam. This is the introduction. So, general suggestions for preparing for the exam. You really want to understand an overview of the exam. So it's important to note that there are 175 questions and 150 of those questions will be scored. 25 of the questions are kind of practice questions that they may use on future exams. They're just kind of researching, how many people get it right? Is this a good question? Things like that. Typically, 86 to 88% of individuals who take the exam do pass. So you can pass this exam if you study adequately. And a pass score is considered 350 in kind of the test center, but you will know right after you test if you pass. There's really no waiting period. You typically get an email in a few minutes. So the most likely diagnoses that will be on the test are going to be the overall diagnoses that we study in the DSM-5. We're not really going to get any questions related to rare diseases or atypical presentations. It's going to be very straightforward in a sense. They're really testing us to see if we can practice as a beginner nurse practitioner. We want to think about the most likely presentation of the patient and common therapy and other treatments that we may use for them. So the mapping of the test, there are 5 sections. We have scientific foundations. These are 33 questions that make up 22% of the test. Advanced practice skills are 41 questions and it makes up 27% of the test. Diagnoses and treatment are 33 questions that make up 22% of the test. And psychotherapy and related theories, there are 17 questions that make up 11% of the test. And ethical and legal principles make up 26 questions and 17% of the test. So when we talk about what is in each of those sections, like what is scientific foundations, what am I being tested on within that section of the exam? So what that section is testing us on is nicely in this chart. Advanced knowledge of pathophysiology, pharmacology, psychopharmacology, anatomy and physiology, neurodevelopment, psychogenomics, and physical assessment skills. The advanced practice skills section is going to be looking at clinical interviewing, health promotion and disease prevention, mental health screening tools and interpretations, mental status exam, management of psychiatric emergencies, psychoeducation, recovery, resiliency promotion, risk assessment, substance use disorder screening tools, and interpretation. The diagnoses and treatment section is, again, looking at that DSM diagnostic criteria, complementary and alternative medicine treatments, skills, diagnostic and lab tests, and interpretations of those tests, what tests you would use for what presentations, differential diagnoses, evidence-based practice, psychopharmacology, and psychotherapeutic management. When it comes to psychotherapy and related theories, we really need to know about psychotherapy principles, change theories, developmental theories, and family theories, and also have skills in creating a therapeutic alliance and managing boundaries and trauma-informed approaches. And then the ethical and legal principles, this includes knowing the Bill of Rights for patients, understanding scope and confidentiality, and scope and standard of practice for psychiatric mental health nurse practitioner roles. And then having skills with cultural and spiritual competencies, equity, diversity, and skills in ethical decision-making and patient advocacy. So remember that our schooling was designed to prepare us to take this exam. Our instructors also took a similar exam. Reviewing videos like these will help you in being able to understand the topics that you need to know. It is very important to set up a study plan. We do not want to be cramming before the exam, and we want to have a well-rounded plan that will allow us to study adequately and understand the concepts that we need to know. And we want to make sure that we're studying in a place that avoids distractions. Things like social media can be really hard to stay off of. So, we might need to take our phone and place it far, far away. So our exam is really focused on psychiatric mental health nursing. However, we have to remember that we did take an advanced health assessment course. And we do have our nursing background. So we also have to keep in mind that, we should have a basic overview of the body systems and of, very common medications that may be found in our patient population. So, a lot of antipsychotics are going to give us side effects like increasing weight gain and lipids and cholesterol. So we're going to want to know the medications that are going to be helpful in that. Remember that there's no penalty for guessing. You don't want to leave questions blank, because if you leave them blank, they will be marked wrong. When you're taking the exam, you will be allowed to mark questions. You can flag them that allow you to go back later and review them. If you come to a question and you find yourself sort of stumped, just flag it and come back later, because again, you only have a short amount of time per question, and you don't want to sit on a question for 5 to 10 minutes debating about the answer. That's really just going to increase your anxiety, start to make that timer be counting down, and we don't want to do that. If you don't know it or you're not sure, just flag it and come back to it at the end. The tests are integrated, so all 5 of those sections that we mentioned, all the questions are mixed together. You won't be doing like section 1, section 2, section 3. They are all jumbled together, and you take 175 questions at one time. It's also important to note that there is no stop on the timer. So if you need to use the restroom when you're taking the exam, your timer will continue to count. And when you come back into the testing center from using the restroom in the hallway or wherever it is, you will need to be researched. So if you really need to use the restroom, just take into account that it really can take 5 to 10 minutes off your exam time. So I recommend using the restroom before you start. We also want to remember our symbols that we learned when creating family mapping. So, just keep those in mind. And we want to remember to practice our own mental wellness. So taking good physical care of ourselves, getting plenty of sleep and exercise. We do not want to cram the day before. I actually recommend minimally reviewing, if even reviewing at all, in order to allow your body to relax so you can be on your A game the next day. Visualization, note-taking, rehearsing, synthesizing the information, practicing, self-verbalizing, and justifying. These are all ways that we can deal with the stress of this exam. So, for example, we can visualize and imagine ourselves passing the exam and how good it would feel. All right. So, we want to institute a systemic study plan. So we want to have a concrete study plan, not like, oh, I'm going to study for a month before the test. How are you going to study? We want to write it out. So writing out this formal plan, what I did is I broke it down by week, and each week I knew that there were certain topics that I wanted to cover and review and certain chapters in the purple book that I wanted to review. So I recommend doing it that way, creating kind of a timetable, getting your resources together. So, I had the week and then I had my resources. So purple book, I'm reading this. The purple book, those chapters line up with this review course for whatever module that is. And then for this other review course, it lines up with these chapters. So I did take multiple review courses, which is what helped me put together these videos that you are going to see in this sort of review course. I felt like I was able to take all that time that I had put in and put it into a much shorter, condensed version of what I feel that you truly need to know. All right. So identify the resources you're going to use to study. So books, review courses, YouTube videos, also remembering to study the body systems, but having a big emphasis on, mental health, assessment, differential diagnoses, plan of care, and common problems. Also keep in mind, how do you best learn? If you are a visual learner, listening to a podcast or listening to this YouTube video may not be helpful if you're only listening. But if you're a visual learner and you're using this video and you're looking at the slides and you're printing out the slides and you're writing down on the slides, that's what's going to help you. If you are a learner who needs to act things out, that's a little more tricky, right? So the best way to do that is to kind of listen to something like this, take your own notes, and then try to teach it back to yourself. But knowing the best way that you learn is what is going to help you solidify these things in your mind. And then strategies immediately before taking the exam. So the final preparation suggestions. So a test success tip: no critical safety information related to practice. So when you have a broad knowledge base, you should be able to analyze and synthesize information. We want to build a solid clinical knowledge base using critical thinking skills, the mental process of actively and skillfully conceptualizing information. We want to be able to case formulation and also critically think. So again, for each patient presentation, we want to be able to think about it from a biological, developmental, and social lens as well. So when we talk about analyzing, this is when we can look at something and look at different parts of it and study how they are interrelated. To synthesize, we are combining information to come out to a kind of conclusive statement. And then critical thinking, being able to conceptualize, apply, analyze, and evaluate information and then come to a conclusion. So it's important to know our test taking style. So for this exam, we want to keep in mind that we are being timed. We don't want to rush through the exam without reading the question thoroughly. And we want to keep in mind that we want to keep between 45 seconds and 60 seconds per question to be able to finish with enough time to be able to review at the end. When I was taking the exam, I was shooting for 60 seconds or less per question. And when I got to the end, I did have 30 minutes left to review the exam. But again, making sure to read that question fully and also read all 4 of the answers before you make a decision. It's also important that you get to the test center on time, know where you're going, review it beforehand, do a street view so you know what the building looks like. You don't want to be late. I actually recommend being early, so I came an hour before my scheduled time, and I was able to start taking the exam early. Also, in talking to the testing center, they informed me that sometimes you can have a wait. So for the psychiatric mental health nurse practitioner exam, they have to kind of do fingerprinting and take our photo. So the check-in takes a bit of time. And if they have a few people taking exams that require a more thorough check-in process, you can be waiting up to 45 minutes to test is what they told me. And I know for me personally, I was already super nervous. Showing up to the test center and then having to wait 45 minutes past the time that I was expected to start would have made my anxiety skyrocket. So I just recommend get there early, know where you're going. God forbid you get lost or you can't find the room in the building. It gives you time to not stress and be rushing, and then you don't have to wait in line as well. The night before, we want to try to get a good night's sleep. We don't want to drink alcohol. We don't want to do anything that is going to make our brain sluggish the next day. We want to eat well, make sure that we are hydrated. Taking electrolytes can be good as well. At the testing center, they will give you scrap paper or like a small whiteboard to write on. There are going to be certain different assessments that we do with patients that different scoring indicates different things that you will have to memorize. When I walked in, I wrote down the kind of mnemonics that I use to memorize those on the whiteboard. And that way throughout the exam, as my mind started to hurt because it's a long exam, I didn't have to rethink about those mnemonics. So I found that helpful. And nothing else is allowed in the exam room. We do recommend that you bring earplugs. I really like that. I know when I was taking my exam, somebody was in the room, they kept coughing. It was very kind of distant because I had earplugs, but if I didn't have earplugs, I think I would have been even more frustrated than I kind of was, because, you're trying to focus and read this question and people are just like coughing. It's can be quite distracting, especially when that timer is going. So just remember, when you get to the test center, you will be required to put your stuff in the locker. You can't have a phone, you can't have a smartwatch, nothing like that. And they will kind of do a search of your pockets and things. So again, we talked about getting there early. Think positively. 86 to 88% of people pass. That can be you. That will be you. You're watching these videos, you're prepping adequately. That is what it's important. And remember your anxiety reduction strategies. So I'm a huge fan of deep belly breathing. It stimulates the vagus nerve. And as nurses, we know when you vasovagal, you pass out. You will not pass out from belly breathing. However, it will reduce your heart rate. It will reduce your blood pressure. For me personally, I always close my eyes and do 10 deep belly breaths anytime before I take an exam. And then positive mantras telling you that you can do. So all of the questions on the exam will be multiple choice questions. There are no other types of questions. They're all multiple choice, 4 answers, and you select the best answer. So when we are selecting answers, things we want to keep in mind, very similar to our undergrad nursing school, but a little more expanded, is level of priority. So we always remember airway, breathing, circulation comes first. That means that we're going to give an example question. That means if you have a patient that has just slit their wrists and you're in the emergency room and you're seeing them, the priority is vital signs. Like after, like, if the bleeding is covered and you are going in, you want to know what the vital signs are, because airway, like if it says, what is the priority when you go in the room, right? Potential answers could be, checking vital signs, or asking about suicidal ideation, or asking about safety at home. Like those might be the answers, but the priority is going to be that circulation. Because if you walk in that room and that patient is passed out, or they have a low blood pressure or whatever it is, they may need some medical stability before we move on to other things in our assessment. So again, we're always remembering airway, breathing, circulation comes first. Then we remember our Maslow's, right? At the bottom, we have kind of food, water, warmth, those basic kind of needs, security, and then the psychological needs, and then the self-fulfillment needs. And we have to think about that a lot with patients in psychiatry, right? If people don't have their basic needs, like a home or an income, how are they supposed to manage their psychological needs? And that's where they might need outpatient supports and things like that as well. And then also just, remembering the nursing process, we know ADPI, and then keeping in mind critical thinking of how it is related to, we're doing our assessment, we're doing our diagnosis, we're doing our planning, our implementation, our evaluation. That is the nursing process that we go through as nurses. And we want to make sure when we're reading a question that we analyze the information given. So number one huge thing, this is really big for me because I do this all the time, do not add to the question. The people who write the question give you all the information that they feel like you should know to answer the question. So don't add to it. If you feel like, well, I read this question, but like if this was happening, then I would do this, don't add but. If you find yourself saying but and adding on to the question, don't do that, right? All the information is going to be in the question. We don't want to overanalyze, right? Again, it is testing us on basic nursing knowledge. This is not going to be a question about like, well, what about if this person had like a tumor and it's a rare tumor and that's causing, different endocrine things? And no, right? This is not basic psychiatric mental health nurse practitioner stuff, right? It is testing us on the basic stuff. So don't overanalyze, don't add to it. Just take it for what it is and answer the question. Okay. So when we analyze information, we want to be asking ourselves, are we supposed to be recalling a fact, applying facts to a situation, or understanding and differentiating between options? We want to figure out what is the person who wrote this question asking of us. So again, we want to read the question and think, what is the writer asking? We want to look for phrases and words that lead us. These help to determine what kind of answer the question requires. So keywords are things like avoid, best, accept, not, most, significant, likely, of the following, most consistent with. A big keyword is priority. You may see that. What is the priority action, or what is the first action you should do, right? All of those things indicate a priority. So we know even if we should do 3 of the 4 things listed below, sometimes it's usually 2, right? You're like, oh my gosh, there's 2 right answers. So you do both, but which one would you do first, right? And we have to look for those keywords in order to identify that. So again, we want to read all the answers. Even if you read the question, you read the first answer and you're like, yep, that's it. You want to read the rest of the answers. That's because you may come to another answer that you're like, oh, wait, actually, I think that's it. And then you go back to the question and you reread it and you're like, oh, I see. It is that second one. We want to make sure that we see all of the options available to us. Within the test, you will also be able to cross out answers. So if you know 100% that is the wrong answer, cross it out. When you're going through the exam, you want to go one question at a time. You don't want to be jumping around because then it's going to kind of get confusing about where you are. So go through the entire exam, flag the questions you're unsure about, and then at the end come back. There's actually a button that says flagged questions that will actually just pull up all the flagged questions. So you don't even have to like scroll through to find them. It will show you the ones that are flagged. So a big thing on the exam with these questions is, again, you want to look at what they're asking. If they're asking for an intervention, your answer should not be an assessment. Even if you would do that assessment for the person with that condition, the answer should be an intervention if that's what they're asking for, and vice versa. If they're asking for the assessment, even if one of the answers is a correct intervention, that is not the answer. So we need to be very careful with the wording within the questions. And keep in mind that if 2 answer choices sound very similar and they both seem like good choices, we want to go with the least invasive way first. We also want to keep in mind that if there are 2 answer choices that are the opposite, these are just test-taking techniques, that one of them is probably the right answer. If the answer is a number, usually one of the numbers that is in the middle range is going to be the right answer. We also want to keep an eye out for distractors. Which may contain aspects of the correct answer, but always err on the side of caution. And again, more test-taking tips: only change an answer if you have a compelling reason, such as you remembered something additional or you understood the question better after rereading it. Most often people change their answer to a wrong answer rather than a right answer. So again, these are not going to work 100% of the time, but these are just some test-taking tips that can be helpful. You want to remember that you're being timed. So we don't want to spend a large amount of time on one question. If you can't answer it quickly, mark it as flagged and move on to the next one. If time is left at the end, then return to that difficult question. We can make educated guesses to eliminate the obviously wrong answers, and trust your instincts. Make sure to answer every question, and occasionally you will find a question on the exam that helps you answer a previous question. So about the certification exam, so again, quick review, 150 questions are the ones that you're being tested on. There's 175 total because you have 25 kind of practice questions. For each case study, you will find 1 question, and each question will have 4 answers. You can skip a question and then come back at the end of the exam, but you cannot mark keywords. So when I took my exam, I could mark keywords. It let me use a highlighter to mark the keywords. So I think might be a mistype. All right, and you will get your results immediately, and a graded report will be provided to you when leaving the test center. I hope you found that helpful, and let's move on to the next section.